Hi, it's Lisa DeBoer coming to you live from beautiful Portugal, and I am here with my new friend from the Lifecast company, and Stuart is going to be telling us about the amazing products that they have for you educators that are looking for some realistic mannequins to help with your training, and we have a very huge surprise that just came out recently for the very end. So stay tuned to see what Stuart's going to show you that just came out. You won't want to miss it. All right, Stuart, you've been with Lifecast, you said, for 5 years now?
I have, yes,
okay.
Lisa, thanks.
And so you obviously love the mission and what you're doing. Tell us just a little bit about what you do and your amazing products.
Absolutely. We started about 6 years ago, and we're based at Elstree Film Studios, just north of London, in the UK. And we really started out to try and bring together all of the artistry in the film industry of creating mannequins and giving them a medical application. So that's really where we started.
Okay, great.
We've also been on a journey to obviously make mannequins look like real people. That's been our top mission.
Yes.
and by doing that, we have to be inclusive and diverse in the mannequins that we produce. And so we really started off with the age diversity. So we do, as you'll see here, from the smallest mannequin. So this is a 22 to 23 week gestational age, extreme low birth weight.
And when I was picking up, this is about, what, 500 grams?
Yeah, it's 500 grams. So we wanted to make sure that the size and the weight as an average were correct.
Okay.
So when you work with mannequins that are this realistic, you get that closer experience to the work.
And that's some of these that I'm looking at. I mean, just not only the weight and how these feel, and you know, for our educators out there that are always looking for something more realistic for your students, you know, these are absolutely incredible. All of them are able to be ventilated,
Correct.
intubated. So you know, when you're looking for those kind of things for your mannequins, these are absolutely beautiful.
And I think things like weight is important, because if we're trying to teach things like choking, we want something that's actually not that easy to get in the right position. And that's why we make them the realistic weights as well.
Yeah, he's got all the wobbliness that you would expect of a toddler. So.
And we decided to set on a journey to create a mannequin, which we think is the first mannequin in the world that is a proper representation of a Down's child. And that led us to Gwen and her family. And Gwen allowed us to do some casting of her hands and feet. So we've got actual true representation of her hands and feet.
So can we zoom in on some of the, because there are some very unique things with Down's patients.
You see the toe separation here? That's one of the classic parts of children with Down syndrome. Similarly, if we have a look at the hand, you know, we've got a deep central crease there in the hand, which again is another classic part of children with Down syndrome. Gwen is a proper representation as a mannequin for the real child. By the nature of children with Down syndrome, they are typically difficult intubation mannequins, and this is absolutely representative of that. We've got a slightly swollen tongue as part of that design. So that leads to, in terms of technique, it will lead to discussions about, well, how do we manage this airway? This is not a conventional airway management patient, obviously. But if you look, when I do ventilate Gwen, you'll see, we've tried to represent a realistic chest movement, and the volumes and the resistance that I'm feeling are again representative of real human values, and that's important.
Yeah, absolutely.
When we're trying to learn.
When you and I were talking earlier, you were saying, okay, so if a medic comes in and doesn't have a familiarity with a Down's patient and tries to intubate in our traditional way, bad things are going to happen. So tell us a way to not let that happen.
Yeah, absolutely. I mean, the classic is that a lot of children with Down syndrome have issues with the vertebrae at the back, typically C1, C2, and we cannot do the conventional head tilt, chin lift maneuver, because that actually can be quite dangerous. And therefore, we need to keep the head and neck in a more neutral position, and because of the size of the neck and the slightly enlarged tongue, we need to think of other airway devices, airway interventions. Now, it might be video laryngoscopy if you've got a difficult airway blade. It may be using fibre optics to then railroad something in if you want to intubate.
Okay.
But these are all the kind of discussions that can really only come from something that presents to the audience in this way. And I think part of our mission was to, as much as anything, do techniques. It was also to start those conversations.
Absolutely.
But this is a child that is different.
Yeah, absolutely.
In terms of its challenges, and how are we going to deal with that? Well, that opens those conversations.
Well, thank you so much for showing us your just absolutely amazing products and being a part
Absolute
of
pleasure.
this company. If people wanted to get more information from you, they would go to what website?
Our website is lifecastbodysim.com.
Fantastic. Stuart, thank you
Thank
so
you.
much.
Thanks,
it was
Lisa.
a pleasure. I appreciate all that
Likewise.
you do. So thank you.